Huples cat, and I think Wolfie. We're still figuring out a name for him. Just going to talk about COVID and what's going on December 16th. So Wolfie's from South Carolina, and he's a bit thin and he's a bit old and he's a loving boy. So first up, I'm going to put up a video. The video is very key to me. I believe firmly in strong lockdowns, and I also believe firmly in government subsidies for those affected by the lockdown, and I firmly agree with this guy. It makes no sense to do partial lockdowns.
Good evening. A federal judge is refusing to overturn Michigan's highly controversial ban on indoor dining. This as COVID-19 infection rates and fatality rates continue to surge statewide.
This, of course, follows the lawsuit brought on by the Michigan Restaurant and Lodging Association. News Channel 3's Tavarius Haywood joins us live in Portage with the details on why the judge said no. Tavarius, is everything okay?
Okay.
Our government leaders have abandoned me.
Are you the owner?
$4 trillion of stimulus money. They gave it to who? Special interest groups and campaign donors. I'm Dave Morris. I own the place.
So what's going on?
What's going on? You know what's going on.
Tell me. You tell me.
Hey, we got a government that has taken the stimulus money. They gave it to special campaign donors. They gave it to special interests. They abandoned me, and they have put me in a position where I have to fight back, okay?
So do you feel that this is the right thing to do?
Absolutely. I feel everybody needs to stand up. Hey, listen, there was enough money to give every family in this country $20,000 to go home for 2 months. They chose to give it to special interests and campaign donors, the Kennedy Space Center, and they abandoned us. So you could have given me money. I'd gladly walk away for 60 days and let this virus settle down. I'm not going to do it alone, okay?
Are you going to continue to violate the state's orders and stay open?
This is a state order. This isn't an order. This is a conspiracy. This is a tyranny.
What do you want to tell other restaurant owners who...
Wake up. Stand up. This is America. Be free. I got patriots coming out supporting me the last 2 days. You know what? It's a great thing. Wake up. This is America. Don't let them ramrod you. This is crazy when you turn around and you watch what's going on West Orange Avenue, the big department stores, the train station, the airports, side by side eating meals for 4 hours. And you're going to blame me? Come on. Come on. This is not right, and you guys know it. Everybody knows it. Stand up, America. Give us the money to shut this thing down and calm this virus, but don't take it out on a select few.
Is there anything else you want to add, sir?
That's it, brother.
All right.
I'm glad you listened to me. Thank you. Hey, I'm really
the entire
humorous
West
guy.
Michigan just listened to you. You're live on TV right now.
All right, I'm glad to hear that, okay?
Yes,
I'm really
sir.
a good guy.
Yes,
I've been
sir.
married 38 years. I got a wife, 3 kids. I got 4 great-grandchildren. Let me tell you something. I got a good life, and I've worked hard for it. I'm not giving up easily. I'm not going down alone. They want me to go down and be quiet. They never want to hear from me again. I'm not going to put up with it. It's time to rise up.
Got you.
Got to rise up. Shut it all down, or don't shut any of us down. That's the only way to get control of a virus.
I haven't got hold of it yet, but early research data out of the United Kingdom suggests that Tier 1, Tier 2 don't really do anything to slow the spread of COVID-19 disease, which is the point. But obviously any sort of restriction on business and movement causes economic pain. It is suggested that Tier 3 actually does function and work. So again, a full lockdown will work. A partial lockdown may help, but it won't work, and it will cause huge economic pain. Whereas if we go for full lockdown, everybody affected could get almost all of their loss of income replaced by the government. And debt is required to fight world wars. And COVID-19 is a world war. I'm going to show a little bit of American nursing experience and respiratory therapist experience. And I'm going to put text on the video to explain what you're looking at. So if you listen to these videos, I would encourage you to actually watch this part.
Says I have no concept of time. The patients are a lot more sick than they were the first time around. It really does feel surreal.
It's living in a science fiction movie.
From here.
We're tired. We're exhausted. It just, a lot of times it doesn't feel like there's a lot of gas left in the tank, to try to do it. we're still, our patients are our number one priority, so we overcome that and, put our boots on and get in here and get it done. But after the end of the day, it's tough.
Yeah. See you guys. The ones that are squared are ones who we're watching closely to go to critical care.
The patients are a lot more sick than they were the first time around. We have a lot more of them. They're younger. I didn't have any patients in their 20s back in the spring. I worked on Monday night, and that was our second intubation, because so far I've had an intubation every shift I've worked for the last week and a half. And I drove home and got in the driveway and kind of just broke down. It's a lot. You hate to see these people who are, completely fine and they just can't keep their oxygen up, and then they have to go up to ICU and be ventilated. And it's a lot. And I feel like it's just going to be around for a while.
On the lowest amount. They're saying that possibly tomorrow or the next day to go home, probably the day after.
That's what I think is hard for my caregivers is they bust their tails here, doing very hard things, doing very emotionally draining things. I mean, these conversations are not easy. You see their last calls on Zoom. You see how it's like impacting families, and then you think, what if that happened to me? So you go home and you still think about that. Like, you don't just leave it at work. And then you have maybe kids that need to go to school. And then you just, where do you find your recovery time as a healthcare worker? And I think that's the thing that you have to really focus on. Try to keep myself hydrated. I try to do yoga, meditation, just do some self-care, because I can't help people if I'm not doing okay.
It's been hard, and it's also been actually incredibly rewarding. This is what we were trained for. This is our purpose in a way.
We're tired. We're a little bit numb. My emotions aren't as high about it, but I think we've also learned a lot more about the disease. But the fear still it's not gone. It just is in different places for different people. I'm fearful. I would probably be fine. I don't have any comorbidities. I don't have any illnesses. It's still in the back of my mind. Yeah, I could get really sick. But now I'm like, gosh, I don't want to see my parents. They could get really sick. I see people their age up on the unit. Maybe they would be one that would have an ill outcome. So I think we're fearful of all of those things. I think what I've noticed the last couple of weeks is I have no concept of time. It really does feel surreal. People will ask you like family members, what do you want to do for Thanksgiving? Or hey, did you think about this? Or what are you going to get the kids for Christmas? Or just things like that. And it's like, wow, you have the capacity to think about that right now.
The way this has been politicized, pardon me, but it just pissed me off to no end on both sides of the argument. I think it gets so politicized on both sides that people get even more focused on their stance and don't want to listen to anything. That it truly is defeating. This is a real virus. This is a real thing that we're experiencing. The vast number of people that get COVID, it's a really bad cold. They get sick and they recover. But the people that don't, it's really severe. I just wish we could take politics out of all of this and focus on what's happening right now.
And now I'm going to discuss some things from my hospital, things that have come up in the last week that you can look at and you can think about in terms of what's going on. First off, for the big data, the Ontario data, my province is Ontario in Canada, suggests that our case numbers are rising, which suggests that the R factor is over 1. And it also suggests that the ICU and the hospital admissions are also rising. As you can see from this nurse, who actually is what we call CNRT, she actually is critically care trained, very young nurse, and she goes to different areas that need help, like Emerge or the ICUs. As you can listen to her experience, you can understand some of the stresses and strains that our younger nurses are really going through right now, because they're taking the brunt of all of this.
When Canada's first COVID patient arrived at Toronto's Sunnybrook Hospital in January, we knew so little and feared so much. It was Clarice Shen who cared for that man. He'd end up in the intensive care unit, and she would follow, taking on 12-hour shifts when more nurses were needed for the coming surge.
We knew that he was a suspected COVID patient. At the time, we didn't even have a name for the virus, really. We were just calling it N2019.
It's been a steep learning curve for a young professional who just graduated from nursing school.
They get sick really, really fast. They can present to the hospital with very mild symptoms, and they can progress very, very quickly to the point where they need to go on a ventilator.
When they're that vulnerable, the results can be almost unbelievable.
I was taking care of this patient on a ventilator, and he has this thing where his body just automatically does a little twitching motion where his teeth bite down on the ventilator, and his teeth were actually coming out. Like he had bitten off a part of his tongue and his teeth were coming out.
One of the particular tortures of COVID is that, particularly in those early days, those who died did so without family around them.
There have been instances where I've had to fill that role for patients, and even though I try my best, and it's very sad, because these are people who have lived very full, vibrant lives.
There is one patient in particular who Clarice remembers.
I'm trying to comfort this woman in her last moments, but all I can really tell her is that I love the color of her nails and that her hair is beautiful and that her daughters love her. So I eventually just told her over and over again that her daughters love her. They wish that they could be here. I just told her that over and over again until she passed.
Clarice has seen a lot of death this year, and it's taking a toll on her and her colleagues.
It's causing us some burnout for everybody because there's so many patients that are coming in with these advanced needs. Last week you had 2 COVID patients in the hospital, and this week you have like 15, and you have 6 waiting in the ER, and you have no beds in your ICU. And then you're trying to get people out of the ICU who would benefit potentially from a few more days of staying there.
The other thing that you will notice from this is that she says that, we go from 2 to 15 in 1 week of cases in the hospital. That's absolutely true. We spent about 6 weeks with 0 cases up here. We were very fortunate. And as you'll now see from this, which is not for publication and all rights are reserved, you will see that our caseload is actually pretty much more than the 15 it was, and it's still rising, and it's causing us problems. So what's the hospital doing with it? Well, this is the public information they've put out, and there is private stuff that us managers are aware of that I'm not going to get into about holidays and Christmases and other stuff. But the bottom line here is that we have not got the capacity to deal with the patients we have, purely in terms of nursing support. We don't have enough nurses for this. So they're going to go back to team nursing in the ICU. That means you don't have your 1 ventilated patient, which is the gold standard to give care. And these patients are very complicated. You'll have 2 or 3 patients and there'll be 2 nurses looking after them. And that will expand because we know we're running out of ICU nurses rapidly, and they take a long time to train. You'll also see the vaccine. You'll also see the information we're getting and giving people about the vaccine in Canada, in Toronto, in Canada's biggest teaching hospital that's a trauma unit. You will see that the amount of vaccines available is almost none, given the need, which is the entire population. You'll see that they're going to focus on trying to prevent patients coming to the hospital rather than protect the staff working in the hospital, at least initially. This might bite them. If we get outbreaks, and we have had outbreaks, but if we get an outbreak in our hospital that kills staff, and it's possible, you're going to see mass sick calls. And I think it's maybe a mistake. I think it's okay to give it to the outbreak nursing homes and staff first, absolutely, and then give it 50-50 to ICU nurses and floor nurses and emerge nurses and paramedics who are looking after COVID patients, and half of the doses go to regular long-term care homes and personnel who haven't had outbreaks. I think this might have been a mistake. We will see. Hopefully I am wrong. Hopefully no hospital in Ontario will get a staff outbreak that kills more staff. There have been staff outbreaks that have killed staff, principally in long-term care. To finish up, I'm going to show some stuff, other people's experiences around Canada, and you can listen to what they're going through and you can think about what they're going through. I will reiterate that this is not a political vaccine. It's not a political disease. It is killing a large number of people around the world. The chances of dying from it if you catch it are fairly small. But let's be honest here. If it's 1 in 1,000 people catch this and die that are like you, are those the sort of odds that you want to face every day in, day out, through 2021? Obviously in Canada, unless we get a lot more vaccine, we are going to have this with us throughout 2021 and into 2022. There's no doubt about that in my mind. There was no doubt about that in my mind in the first place. And I strongly suspect the United States of America is going to face the same sort of vaccine shortages that the rest of the world is facing. Maybe not, but maybe you will. We shall see.
Sometimes the caregivers become the infected. It happened on the job to Shay Fleming, a cardiac nurse at Calgary's Foothills Hospital.
I was one of the first people to test positive coming from my workplace. You know, head cold, some shortness of breath, cough, runny nose, lost my sense of taste and smell. For the most part, I couldn't get out of bed.
She's turning to yoga to center her after a 2-month fight with lingering symptoms. So significant, she's been unable to work for 2 months.
That shortness of breath and that chest tightness and heaviness has still been one of the most frustrating parts, for sure.
Not just frustrating, Shay also feels shame. However misplaced, guilt that while sick, she hasn't been able to help her colleagues.
You know, as a 29-year-old, having shortness of breath and not being able to walk a kilometer down the pathway, you know, makes you feel pretty shameful as well.
Fleming's return to work coincided with a major jump in cases in Alberta, adding to the stress.
Our ultimate goal is to care for people. And I think right now that's really difficult for us because we're trying so hard to care for these patients and do what we have always wanted to do as a nurse. But it's just, there seems to be no end in sight at this moment.
A vaccination program is going to take us well into 2021. It's going to take the better part of the next year to roll this vaccination program out. So that means that we are still going to have to follow all the rules. This is not an instantaneous, we're going to go back to pre-COVID times and there'll be no rules on it. That is not the way this is going to be. We are still going to have mandatory masking. We're still going to have to follow all of the rules and regulations set out by the Chief Medical Health Officer around, you know, the keeping our groups small and social distancing and only going out when necessary. We cannot have any sort of conversation out there that's going to make people think, oh well, perhaps we can soften what we're doing and have more people at our house at Christmas.
Anyway, that's all from me. This was a brand new Terry production, 2020, and I think we're going to call him Wolfie. But if anybody has any suggestions, you can let us know. They called him Tigger or Tig, but as you can see, he's not responding at all to any name. He is not deaf. Toodles.